What's the state of science in soil health best practices in terms of reducing heavy metal bioavailability? Do we know anything about that? Do we know how soil health practices or practices that promote soil health, how those affect heavy metal bioavailability? What practices do that? How much science do we have on that?
We have quite a bit of science for some properties. For cationic metals like lead and cadmium and a few of these things, raise the pH. Raise the pH, bring the pH up. It reduces metal bioavailability. Where it gets a little trickier is when people say, well, add organic matter, and then you got to ask, for what pathway? I think the real trick here is we're very good. We know quite a bit of how to reduce metal uptake by plants. The question is, what about ingestion of soil? And that's where the unknown is. Like if they say just raise the pH, add limestone, sure, it stops plants. You make carbonates, lead carbonate. And what happens when you eat a lead carbonate? It all dissolves and goes in your blood. So it doesn't do anything for that pathway. So you really got to have both pathways because if ingestion's your risk driver, then plants are not the right thing to be looking at. So I guess I would say for plant uptake, we know a lot. We know a lot less for ingestion.
Okay. Any other comments on this?
Well, I would just say this is where nutrition comes in, because we already know there's a link towards nutrition and how much metal will actually be taken up and go into body parts versus being excreted. And lead's a good example. We know if, I tell my students in my class, it's not that, low-income parents don't watch their children, so they're the only ones getting polluted with lead. It's just that they usually also don't have a good diet, and so they're a lot more impacted by lead in the city, for example, where we're all being exposed.
And let me just ask.
So, Nick, I would also ask if you surprised you didn't say anything about addition of phosphorus to lead or the use of metal oxides.
So I mean, phosphorus, we know that if you make lead pyromorphite, it's very stable, it lasts a long time. And in fact, in some of our soils, some of the urban soils we looked at, people have already made it and they didn't know it. So if you've ever added phosphates to your soil, you may have already made this product that's very insoluble. There's one other thing at the nutrition thing that I think is important. There was a study years ago to show that it actually, the damage can be done in utero if you have poor nutrition, and you can have up to 1/3 of the bone mobilized during pregnancy. And if people have a high lead burden in their bone, you may always, so the nutrition is actually, should be started to protect the next generation. So that's the other thing, is if you have good nutrition, you don't mobilize bone, if you have good calcium nutrition. So it's the food becomes a preventative measure for a pregnant woman that might have a high lead burden historically in her bone.
Two comments. One trick on pH. So raising pH does immobilize some metals, but it can actually make things like arsenic and selenium more available. And the second thing is we actually know the addition of biosolids incorporated in soils actually reduces metal bioavailability. So, it's another good thing about the biosolids, but it doesn't take away the other things we have to look at. So it's a very complex system is all I'm highlighting.
That was an unasked question from the last panel, so nicely done.
There we go, I answered.
Yeah, that's.
So I think there's a lot known, but when you actually start looking at ingestion, then it becomes thinner. Then I got to have lead pyromorphite. I'm after phosphate, and that could be actually formed. We've seen you don't have to add phosphate. That could actually be, in some cases, formed at the plant root or rhizosphere. You could actually form lead. So you might have the remediation. But if we don't measure metal bioavailability is the only thing that sees the remediation is done. If you measure total lead, you can't see the remediation.
Mm-hmm. Okay. Yeah. Jason.
I was just going to say, not so much for agricultural soils, but a number of industrial contaminated sites, nanomaterials are being used as amendments to soil to reduce metal bioavailability. So things like hydroxyapatite nanomaterials to reduce, uranium bioavailability, or zero valent iron to reduce selenium, mobility and that sort of thing. So.
Well, let's continue sort of along this line, though, and expand on it a little bit. All of you our university faculty. 4 of you are land grant. What are your extension faculty doing about bioavailability of metals in soils, especially in the area of vegetable crop production? And are there any extension publications on this?
There are, some of our extension people we are right now producing more extension information. There's extension information out there, but it's dated. It's the early 90s, and have things changed? Yes, they've changed. So actually we have to update it. So we do have some efforts going on right now. We formed a center essentially at OSU that people are sending us soil for screening. We're putting out fact sheets, or starting to put out fact sheets. But we're one state, right? Mm-hmm. And so it'd be nice if we could do something more holistically across the country.
Well, you got Purdue right next to you. So.
That's Indiana, though.
And then you got, and Virginia. You're sort of all lined up here.
So I do have an extension appointment, and I've used my own research results and the results of several of the people here on the panel with me, with whom we've done shared research on biosolids and other wastes that have inherent properties to which Linda referred, such as the high concentrations of metal oxides that can bind metals, and we've produced extension publications describing the value of biosolids and these other products for that use. The more recent question are those of heavy metals in urban soils, where there's less known, and questions still need to be answered about how to bind these.
One quick question. I mean, the one thing that I mentioned that was new that came up, when CDC dropped the number from 10 microgram per deciliter, now the question is, we have to go back and look, or EPA right now is re-looking at that pathway, and numbers have been kicked around about dropping the screen levels to 150 and things like that. So now they're starting to look at the pathways, and when you drop those numbers, you may start saying, oh, well, maybe metal uptake by plants is a factor now. It wasn't when you were talking about so in a way, we've been going back and looking at old data, and that's where I think the diet coming in protective. By the way, the one thing that all of us agree on is bioavailability should be used in a contaminant framework. You've probably heard that several times, and if you don't do that, then you probably aren't going to be doing any assessment. You'll be doing biomonitoring, because I think the 1 molecule per liter is something called a yoctomolar. 10 to the minus 24, inverse of Avogadro's number. And so I think we're not there yet to measure that. But, I mean, it's just a falling floor all the time. So now the lead number in California is 80. They're thinking about dropping it. So we're actually saying, well, is Earth killing us? Maybe it is. I don't know. Huh?
What are your units? 80 what?
Part per million.
Thank you.
Yes. Yeah. Okay.
All right, let's thank this panel. This has been a very good discussion. Thank you very much.